Are sick right now, and amid rising hospitalizations today, Governor Kate Brown expanding an executive order to help Oregon hospitals fight what some are calling a triple-demic. Our Joelle Jones going beyond the headlines tonight. And Joelle, you're hearing from nurse and hospital associations and why they think this order, though, comes too late.
That's right, Liz. Today's order replaces the one Governor Brown issued less than a month ago amid the rise in RSV hospitalizations. But since then, officials say they've also seen a surge in COVID and flu cases as well, prompting the expansion of this order to help hospitals address increased demand and staffing challenges. And while the associations I spoke with today say healthcare workers are appreciative of this order, they also say it comes too late and could create more burnout for the already strained staff.
Nurses know better than anyone in the state of Oregon just how dire the situation truly is. We just wish that the governor and OHA had acted sooner.
As the weather drops in Oregon, health officials warn cases are on the rise. A statewide surge in RSV, COVID-19, and flu cases prompted Governor Kate Brown to sign her second executive order in less than 30 days. Today's emergency declaration replaces the one issued last month, citing a spike in RSV, and expands it to help healthcare workers and hospitals address a continued rise in cases of respiratory illness and hospitalizations. The order issued today states RSV pediatric hospitalizations have surpassed previous records, with more than 90 pediatric hospital admissions during the week ending on November 19th. And with COVID-19 and flu cases also surging, the order goes on to say statewide overall hospital bed vacancy rates and intensive care unit vacancy rates are each below 5%.
We're concerned that this emergency declaration is going to lead to more nurses deciding that it's just not worth working at the bedside.
Scott Palmer, chief of staff for the Oregon Nurses Association, says while nurses are grateful for the governor's action, he feels it comes about 4 weeks too late. A sentiment echoed by the Oregon Association of Hospitals and Health Systems, who stated today, quote, "We have critically ill children in adult units and boarding in emergency departments who should be in pediatric intensive care units in Portland, but there are few available beds. We've been saying it for more than 2 years. Our system is failing. The unfortunate position we find ourselves in today could have been prevented, and it wasn't."
What that essentially does is it kind of allows hospitals through statute to suspend their reliance on agreed upon nurse staffing plans. And it allows them to just sort of throw those agreements out the window and start piling more and more work on what we know is an already overburdened healthcare staff and workforce.
For this order to be successful, Palmer tells us hospitals should cease all elective surgeries and notify the public on when they are rationing services. But to address the staff crisis, Palmer calls on OHA to enforce nurse staffing laws, saying that it is necessary for Oregon hospitals to keep their healthcare workers on the front lines.
This is not the way anybody wants to run healthcare in the state, and it is certainly not the way that nurses want to provide care to patients in this state. It is heartbreaking, and we need to stop this process of just announcing emergencies, waiting for a few more months, and then announcing them again. It's time to start looking at real long-term solutions.
Now, in response to those claims, OHA says they are committed to enforcing nurse staffing laws at all of their area hospitals, and they say that they check each hospital at least 3 times a year. And while they weren't available to speak with us on camera today, they did let us know they will be holding a press briefing to address the increase in respiratory illness we're seeing throughout the state. That will be held tomorrow at noon. Reporting live in downtown Portland, I'm Joelle Jones, KOIN 6 News.
Yeah, it is just so taxing on so many people, the patients and the staff. Joelle, thank you for that.